So often the owners are not involved deeply in the finance and there's no transparency, and they think they're doing well, and then all of a sudden something goes wrong and they don't understand it and their numbers go down and they get angry or they come asking questions. If they're not understanding, if things aren't transparent, you're constantly going to have this back and forth between the physicians and finance.
Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Welcome, everyone. I am joined today by Matthew McCreith, who I am delighted to be able to call a friend. Matthew has a great deal of expertise in finances and most recently was the CFO for a large primary care group and has recently shifted over to cost reduction consulting and his business at Schooley Mitchell. So Matthew, welcome. Thanks for being here today.
Yeah, Jill, thanks for having me. I'm excited.
Absolutely. Well, Matthew, as you know, we have an audience of physicians and administrators, and I am really excited to share with them today a lot of your background and a lot of your knowledge. So we will jump right in with the first question we have, which is drawing on your experience in running medical groups. What would you say are the hallmarks of a financially healthy medical group?
Yeah, thanks. That's a great question. And I think it's one that a lot of groups struggle with because there are so many different facets to that. One of the big questions you have to ask first is what type of group are we looking at? Are we looking at a wholly owned physician group or a partly owned physician group with employed providers, or a single owner with many employed providers? Because each of those, you're going to want to look at the health financially in a different way. I think for the point of private practice, we'll focus on that physician-owned group where it's wholly owned by every provider that runs, that practices in the organization. And what you want to look at first and foremost is on a provider level, what everybody is doing. You want to make sure that everybody is working towards the common goals and the shared values of the organization. So if everybody is doing that, then everybody should be healthy financially. They should be seeing enough patients. They should be coding correctly. And then from there, you really want to look at collectively what that means for your bottom line. So if you've got everybody performing at a high level, you should see a very healthy bottom line, maybe 30, 40%. That's going to depend on a lot of various aspects to what type of an organization you are. Are you primary care where you don't have huge overhead or huge capital, or are you something like surgery that does have a lot of capital? And looking at that bottom line, not just in a percentage, but also in numbers. So you could have a 30% margin, which sounds great, but if it's $5 million and you've got 50 providers, it's not going to be that great. But if you've got $5 million and it's 10 providers, it's going to look a lot better. And so looking at that bottom line is, and using data points that are out there through HFMA or MGMA or other various groups to kind of gauge where you are with like groups is going to be big. I think another lesser looked at, I wouldn't call it statistic, but just thing that you can, a hallmark of financially healthy group would be if the owners understand the finances. So often the owners are not involved deeply in the finance and there's no transparency, and they think they're doing well, and then all of a sudden something goes wrong and they don't understand it and their numbers go down and they get angry or they come asking questions. If they're not understanding, if things aren't transparent, you're constantly going to have this back and forth between the physicians and finance of questions regarding the health of the company. And you don't want that. You want them to know that you, as a financial professional or a practice administrator, have everything under control, and that you are sharing with them everything that is relevant.
That's fantastic. When you think about transparency for groups, and that is, I mean, what you're saying is exactly what this entire podcast series is all about. It's can we get everyone on the same page of understanding, and can we assist physicians and their administrators and managers with the language of finance? Because that is a different language, and it's not rocket science, and you absolutely can learn it. And the first many parts of this podcast were all about that, the basics of finance and helping people understand. When you think about transparency, say a little more about that. Like, what kinds of things do you like to see in a medical group that are routinely shared with the board and the owners?
Yeah, so I think one is your payers. You want to be transparent with them about renewals, about increases, about what that is going to do to your top line revenue. If they can understand that their top line revenue is not going up 8%, but other expenses might be going up 8%, they're going to be able to just clue in on, okay, there are other areas we need to fix in order to continue to move forward. So looking at those big payer contracts, and then on the flip side, looking at those big vendor contracts, making sure they still align with the strategic growth of your organization.
Mm-hmm.
Your biggest expense is going to be employees, followed by your IT, which includes things like your EHR and um, your protection and all of that. And so making sure that those are not only the right expense, the right cost, but also looking forward 3 to 5 years, making sure that it's still going to be relevant for your organization. And then KPIs. KPIs are always talked about in healthcare, and there are 1,000 different ones you can do, but depending on the size of your organization, there are some that should just be very transparent, and it should be shared across the providers so that they can see how each other are doing, because they all need to be held accountable to the standard of the organization, not the standard of themselves. Looking at yourself on a bell curve between your organization and coding, things like E&Ms, if you're 20% 212s and 50% 214s, and everybody else is 40% 212s and 20% 214s, you might ask yourself, what am I doing differently?
Yeah.
Sharing those type of KPIs will easily get you to the point of asking the questions that you need to ask in order to initiate change so that you can constantly grow and move forward as an organization and not an individual.
Yeah, that's fantastic. We've had a lot of discussion in previous podcasts about benchmarking and about key performance indicators or KPIs. And I love thinking about. I always recommend, keep it simple, sweetheart. Right? It's too many KPIs is not a good thing either.
Yes.
So
Yes.
four or five in a dashboard that. To your earlier point, the practice, owners and partners can understand, and they also understand not only what the KPI means, but how they individually can impact it.
Yeah.
Those I think are the most powerful. But I like your examples from coding. When you look at medical groups, and as you go into medical groups now in this new role that you have, what are some of the areas where you can find the biggest cost savings?
Well, there's a lot of areas to save in cost, just about every area. And depending on the geographic spread of your organization, one location versus five, the type of organization you are, if you're heavily commercial based or heavily Medicaid, is going to dictate where you're going to focus. So when I go into a practice that is over 70% Medicaid, I'm not even going to look at their merchant services,
Right.
because they're not taking payments, and their spend is going to be so low that it's going to be really difficult. But commercial, when they're taking a lot of payments over merchant services, it can be a really big one. If they're taking payment plans, Now with EHRs and everything being integrated, you're seeing a lot more online payments. You're seeing a lot more payments initiated by the payment,
Mm-hmm.
initiating the payment not in the clinic.
Yep.
And those type of transactions are very expensive. And so merchant services is definitely a big one. Telecom is another big one. So if you are geographically spread out and you've got multiple lines, or even if you're a community hospital that is one or two buildings on the same campus, but you have a lot of phone numbers, there's just a lot of room to look at different vendors in the marketplace and get really comparable quotes for the same service, and they will be vastly different. And then anytime that you have a process change or a process improvement, you're going to affect at minimum one vendor, but probably two or three. And the one that comes to mind is as we move more and more to the EHR and less paper, you're
Mm-hmm.
affecting not only your printing, you're affecting your supply purchasing, you're affecting your printer leases, and you're affecting your shredding schedule. And so when you take all three of those and put them together, you can save on your printer leases, you can save on your supply purchases,
Yep.
and you can save on your shredding costs.
Yeah.
And so every time a new process is implemented, you should think about the vendors that it's affecting and where you might be able to change the cost structure and find savings.
Mhm. I love a good paperwork reduction act whenever we can do that at a clinic.
Yes.
I love those where we have process improvement and we remove paper. And it's funny, I always do there was cost savings, but it hadn't occurred to me really like you hit three different spots there. And
Yeah.
that toner is like that stuff's like
Yeah,
liquid gold the way they
it
price it.
is.
So now, thinking a little bit about this, and this next question might be a gimme, but I'm going to ask it anyways. Why do you think our audience should be focused on reducing costs? Why should they care about that?
I think reducing cost is probably the most important thing that practices can do right now. We have payers, and if we look at the payers, chances are 50% of your payments are being brought in through just a few of the big payers, the Blue Crosses, the Aetnas, the Cignas, and they are not increasing at the rate that you need them to. In fact, they're doing everything they can to decrease your reimbursement. And so you're fighting a giant beast and you're this little practice, whether you're 10 locations or 20 locations, you're still fighting a multi-billion dollar company,
Hmm.
and you might be able to squeeze some increase out of them. However, a 2%, 3% increase does not compare to the 8 to 15% increase on the vendor side that we have been seeing over the last year. Your biggest expense, again, is going to be people. You can't really get by without people, but can you get by with a different vendor that does the same thing at half the cost? Probably. And so when you look at a cost reduction consultant, um, or sorry, when you focus on reducing costs, you are pulling the second lever of the equation. You're trying to increase revenue and then you're trying to decrease cost. And that's going to keep your expense and your revenue line as far apart as they should be during the year. And if you don't do that, if you don't focus on expense reduction, you're constantly going to see that gap getting smaller and smaller until your margins are so thin that you are not making any money and you're pulling your hair out because you're seeing 3,000 patients a year and getting no return for it.
Yeah. And sadly, we're seeing a lot of groups that are headed in that direction where they're really feeling the squeeze. And to your point,
Absolutely.
the payers are just not ponying up the way they used to, sadly.
Nope.
But yeah, there's a lot of big challenge. And so thank you for putting that in context for
Yeah.
our audience. On the one hand, it seems kind of obvious, but on the other hand, it's great to think about it sort of at a macro level
Yeah.
with the business. So when you go into groups, what's the average amount of cost reduction that you would see?
Yeah. So personally, I don't focus on every single expense. And so when I talk about averages, I'm really focusing on what I can control. And we're seeing an average of 28%. Um,
That's
and
great.
that
Wow.
it's huge, and it varies greatly. I've gone into practices and I've shared reports with them where I haven't been able to find savings for them. They've been optimized. Uh, Recently, an organization, a healthcare organization with a whole bunch of wireless devices, we were able to cut that bill by 64%.
Wow.
And so, depending on the type of expense and where, it can be pretty large, but on average, it's around 28%.
Yeah, still, that's phenomenal savings. I just think about any budget. So, how often, as you go in and look at these service contracts and insurance contracts, as you were saying earlier, how often do you recommend your clients renegotiate those?
Um, Annually, without a doubt. Maybe not renegotiating them, but whether you are in a 1 year contract, no contract, or a multi year contract, you should be speaking with your vendor regularly. And by regularly, I mean annually, because things change in the marketplace. The way that they charge their clients changes. And sometimes it is the benefit to you. Sometimes it's not, and you want to keep your current contract, and that's fine. But if you are not talking to your vendor, if you are not actively pursuing a better rate, your vendor's never going to come to you and say, "Hey, we changed our pricing structure and it's going to save you $2,000 a year. Do you want to sign up?" That vendor is making a commission off of you. That vendor rep is making a commission off of you. And so it's important. And in the case where you're in a multi year contract, they want to keep you in a contract. So if they offer better rates and they've got great service, and you're willing to forego the last 2 years of your contract and sign another 3 year contract, they might be willing to give you different pricing structure. So it's important that you're just constantly reaching out to your vendors and keeping open communication with them.
That's fantastic advice. We talked a little bit earlier about merchant services, which is the costs that practices pay a bank or a credit card processor to process credit and debit
Yeah.
card payments. And it strikes me in many cases that merchant services is something that medical groups sort of set it and forget it, right? You
Yeah.
probably, if you ask anybody who their merchant services vendor is, they wouldn't even be able to tell you the name because it's in a file somewhere in the back room, and no one's looked at it for a long time. So I could see that's a huge potential. What are some hidden charges that you see with banks and merchant processors?
Yeah. Their merchant services is one of the most complex areas I find. And what happens is, on one side, the banks have just a huge list of what's the word I'm looking for? They are heavily regulated.
Yep.
And the credit card companies, Visa, MasterCard, American Express, they are heavily regulated. This interchange in between them, the merchant service, the gateway, does not have the regulations that they do. And so there's a lot that they can get away with. And in general, there are over 700 different types of interchange rates. And it's all going to depend on what type of card you are taking. And I'm not talking Visa versus MasterCard. I'm talking Visa Business versus Visa Personal versus Visa Airline versus
Yeah.
whatnot. Each one of those is going to be different. And then, is the card present? I mentioned that
Mm-hmm.
more and more payments are being taken online and over the phone. Are the cards not present? Are they on a hosted page versus a virtual terminal?
Mm-hmm.
There are all of these different ways that they can tack on charges, that they can hide these charges in them. And then, because it's so complex, they can spin everything to make it sound to your benefit. So they can tell you, we will give you a 1% processing on all transactions. And that sounds great. Well, they couldn't live off 1% because interchange rates are more than 1%.
Yeah.
And so, how are they going to recoup that cost? Well, they're going to add surcharges on the interchange, or they're going to charge per transaction fee, or they're going to add all these PCI administration fees when really you're the one who has to administer the PCI compliance, not them.
Yeah.
Is there a business account fee? I had a client that I looked at, and I'm not joking. We do an analysis on each individual line item. They had a per transaction fee listed. Then they had an American Express per transaction fee, which is pretty normal,
Hmm.
just two different kinds because American Express is different. But then they had this line called additional per transaction fee. Was that not covered in the per transaction fee? I mean, there's just these things that they can do that they can get away with because they're not regulated, and you might only pay, a percent in processing those fees, and you could be paying thousands and thousands of dollars in other areas.
Yeah. Yeah. I've often said those merchant services bills, when you see one and you get the detail, it's like you need an MBA to,
Yes.
look through it and analyze what's actually happening. And I think, again, a lot of practices do tend to set that up and then not revisit it for many
Yeah.
years. And it seems to me like there's been a lot of shift in the market and there's more competition out there. So that would tend to push the prices down, but only if
Yep.
you're looking at it and shopping it around.
Yeah, there's a lot more competition, but what's getting increasingly more and more difficult is the EHRs are teaming up with merchant service providers,
Yep.
and they're creating exclusivity. And so, if you want to be integrated with your EHR, which has a host of efficiency gains down the line,
Yep.
if you have the chance to integrate with your EHR, just do it. Um, but you don't have as much room to negotiate on the price. What is the price versus the efficiency gains?
Yep.
And I would say the biggest efficiency gain is there's no room for human error.
Yep. Yep. Well, and you also, as your practice size grows, you cut out the amount of time it takes someone to post that payment. If a
Yep.
patient goes on your EHR portal and makes a payment, it automatically credits to their
Yep.
account. There's a lot of, like you said, no room for error there, and there's also a lot of time savings. And
Yes.
I like the shift to the online payments largely because again it's a protection against embezzlement, right? The money
Yep.
isn't going through the clinic at all.
Yep.
It's
Absolutely.
going straight from the consumer's credit card into the practice's bank account. No one gets to touch it. So
Absolutely. And we all know that embezzlement is a huge issue from listening to your podcast.
yeah. Lovely interview with Tiffany a little while back. Yeah.
That was a great one.
Yeah, yeah, it floors me exactly how common it is, and so I love seeing groups that have automated their merchant services and that have automated a lot of their insurance payments for EFT as well. It's
I I recently they're not a client of mine, but I engaged with a practice that is on their second round of embezzlement in a row.
oh,
So,
that
um,
just makes
it,
me sad.
it
Yeah,
is having these payments go through. There's 100 different areas to embezzle through practice, but every time you can automate one to where people aren't touching it, it's a huge safeguard.
you just reduce the risk. Yeah,
Yeah.
that's going to happen. But at any rate, oof. I dislike hearing those stories because I think physicians work really hard, and yeah, it's
Yeah.
sad. Makes me sad. But
Yeah.
at any rate, well, back to happier questions. Let's talk a little bit about the role of a cost reduction consultant and how they work.
Yeah. So, I would say let's start with how they work. That's the easiest one to answer, because we are truly a unbiased consultant who has the best interest of our clients in mind. We want to give them the same or better service at a better rate. We are not vendors, resellers. We do not get commission or kickbacks from anything that we present to our clients. And so that gives us really a way to go in and help an organization out and be a partner to them. And so we work with no upfront costs and risk free. We share in the savings. And what that does is it allows you as a client to get an unbiased analysis done with no risk to you. If there's no money saved, there's no tangible result, you owe nothing. And that is where I really feel that we excel because uh, unlike a traditional consultant who has its place, it requires tangible results to get paid.
Yeah. Yeah.
And the role is really a partnership with the organization. Specifically, myself, it's not a hit and run per se. I don't save you money and leave. Um, it's a service agreement, typically 36 months, where I am there with my client. I am constantly looking for additional ways to save money. Every time that the vendor that they are using changes their pricing structure, I'm going to analyze it to see if it's beneficial for you or not. I'm going to continually bring you the value reports if there were savings to show you where and how big. And then I'm going to be that one stop vendor management for you for everybody that I deal with or everybody that we deal with. If you have an issue with your merchant services, feel free to call us. We're going to get that straightened out and we're going to make sure that everything is in line with what you signed up for. And so it's really a partnership that is built on unbiased results and tangible results.
Excellent. So if our audience is looking for a cost reduction consultant, those are the things, those are the
Yes.
things to expect. That's wonderful.
Yes.
And I have to say, I so appreciate the work that you did for our organization and finding us some pretty significant savings in telephony costs, which I thought were pretty tight, you know? So
Yeah.
it's, even when you're familiar with the business and you're looking at the costs, it still behooves you to have somebody who really can dig in with that kind of expertise. So that brings me to a question, which is, can a medical group achieve these same results on their own?
The short answer is yes, but it is incredibly difficult. And why that is because you and I both know that medical groups are already running on thin margins. They don't have the resources that they need to put the time and effort into something like this. More often than not, I go into a practice and I talk to the practice administrator, and that practice administrator is doing payer contracting, vendor contracting, HR hiring and firing, compliance, provider recruitment, ordering supplies, stocking supplies. They are doing everything.
And
And
finance in their spare time, right?
and
Yeah.
finance in their spare time. And by the way, we still need that 3 to 5 year strategic growth plan. So if you
Mm-hmm.
could
Good
get
to get
that
on
to
that.
us, it would
Yeah.
be great. Um, and when you go into a practice like that, we understand every dollar has to go back to the clinic because that is what makes the money and that is what you are there for. You're there for the patients. But with that type of mentality, with that attitude, you're not giving adequate focus to each one of these categories. And there are hundreds of vendors in every category. You don't have time to go out to the market. You're going to do a quick Google search and you're going to get the top 5 paid vendors. And they might not be the most expensive, but they also won't be the cheapest. They're just the ones that are paying the most for Google ads.
Yeah.
And that's what you're going to do. And
Yeah.
so, yes, you can do it. And as I mentioned, I've gone into practices where we haven't found them savings. They've been optimized. But more often than not, there are many more vendors or resellers out there that you just don't know about that can give you the exact same service at quite a different rate. And so it's important to weigh the benefit of partnering with somebody versus doing it yourself. If you are a 3 doc practice, you probably have the time to do something like this. If you are a 10 plus doc practice, you might not have that time.
Yeah. Yeah. Or the, like you say, the expertise in the
Yep.
background and who all of the vendors are. And so, yeah,
Yep.
there's definitely distinctly time savings there and, quite a bit of expertise
And
that, physicians can expect from an external consultant. So there's the question always, to kind of weigh that make versus buy. And
yeah, and then as I mentioned with the merchant services and over 700 different interchange types, if you're not taking your historical transactions and plugging those in to a calculation. You don't actually know
Mhm.
if what your vendor that you're going out to market for is telling you is actually good or not. They
Right.
could tell you like you're going to have a 3% rate. Well, what does that mean? If you start taking a lot of American Express and American Express is more expensive, that 3% is going to go through the roof. And so
Yeah.
it's that expertise that you talk about and having the right type of software and processes to get down to the best
Yeah.
cost.
And then there's the fee, and then the additional fee, and then
Yes.
the additional fee. I like that.
Yep. Yep.
Yeah, I'm gonna think about that pricing structure. Wow. Well, last question for you is to see what are, I always like to ask a fun question. What are some surprising things that you found since you started in this new role?
Yeah. The first one is I've been in the place of these people going to market where I've Googled things, and I was surprised at how many different vendors there are in the space.
Mhm.
And you mentioned telephony, and you know the company that you were using, I had never heard of.
Mhm.
And then when we went to market, we were able to find multiple other vendors who are voice over IP and offer the
Mhm.
same thing and the same structure. And when you think about something like voice over IP, it is simple. It's a phone number and it's voice over your internet.
Yep.
And so, sure, you could get 1,000 different vendors in this category, and all they have to do is have a software to tie it together. And so it's not that hard anymore. And so, um, just the amount of vendors that are out there is astonishing.
Ah,
Um, and then another one is uh, that risk-free nature that I talked about. Some people take it to heart, and when you offer a group substantial savings and they decline it, it leaves you wondering what's going through their mind. But it's definitely surprising when it happens, and it does happen.
yeah.
Uh,
Yeah.
you can find the same amount of savings for two different groups, and they can be substantial. And one group will say yes, and the other group will say no.
Wildly different responses. Yeah.
Yeah,
Well, and it's nice that your working structure allows groups to decide. We have a really great longstanding relationship with that vendor. We want to stay in that, even though we understand it's costing us a bit more. But
yeah,
that you're allowing people to make an educated decision about it.
yeah,
Yeah. Sometimes it seems very illogical, doesn't it? Like,
yeah. It does.
save them.
And the last thing that I would say that I found surprising is just about myself. I went into accounting and finance in college, and I sat behind a computer my entire career working on spreadsheets, doing reports, and I really thought that that is what I enjoyed doing. And I really thought that I did not enjoy talking to people. But what I found is I really enjoy it. I'm part of different chambers, I'm part of networking groups, and I'm reaching out to clients. And it's just something about me that I never thought that I would admit, but I enjoy talking to people.
Agreed. I love it. Well, it has been a pleasure working with you in both of your last roles. And I want to thank you for taking time to
Yeah.
share the knowledge with our audience today. And we will put Matthew's contact information in the show notes so that you all will get that. And Matthew, again, thank you for being with
Yeah.
us today.
Yeah. Thank you very much. I really appreciate the time. And as always, it's great to get together with you and work with you.
Wonderful. Thank you.
Thank you.
You can find more information online at medicalmoneymatterspodcast.com, and you can also find examples in my book, Physician Heal Thy Financial Self, which is available on Amazon. We've included those links in the show notes. As I like to close out these podcasts, congratulations on taking the next step in your professional development and for making the commitment to learn about the financial and business aspects of your practice. I look forward to being on this journey with you, and I send you my heartfelt gratitude for all that you do for your patients all day, every day.